So I work as a psychologist within a major trauma centre in a large acute hospital trust, and we're a major trauma centre that works age span, so children and adults. And I was asked to go and see a 12-year-old boy who'd had a few weeks before quite a few significant orthopaedic injuries and had some surgery, and he'd been in hospital probably 3 weeks. I had some contact with him right at the start of his admission to hospital, to check out whether he had any sort of symptoms of post-trauma psychological symptoms and that kind of thing. And at that time he seemed to be doing okay, but as his hospital stay, sort of like his stay in hospital lengthened, he was starting to struggle, and the nurses were saying that he was very tearful and not engaging with them much really. And I think because it was a time just after I'd done the foundation training myself, so it was before I'd done the facilitator training, I decided that in the spirit of using it myself, I'd go along with this tool and give it a shot really. And I thought it would be a particularly useful thing because I think he was on a very, very busy paediatric ward where it seemed from my conversations with the nursing staff that they were really concerned about him and were wanting solutions really. And I kind of felt...
Wanting solutions to his distress?
Yeah, pretty much really. I think that was the case. I certainly felt that, and when I went in and had a conversation with them, I felt a pressure to kind of come and sort him out in some way. And given that I kind of saw his distress, given the situation as being very normal, I kind of was struggling with that really.
Yeah, you're a bit conflicted between what you thought was right and what you thought the nurses wanted from you.
Yeah. So I went in there and he'd met me before, and I checked out that he remembered who I was and what have you, and there was not a lot I could do. You know, it's like when you go and see someone in an acute ward, it's kind of like the magic curtain comes round and you try and create as good a space as you can, but the setting wasn't ideal. But I kind of asked permission to speak to him and what have you, and started to ask about what his concerns were, and what he was saying to me was that he was just finding being away from family and friends really, really difficult. And that was the first thing that he came up with really. But when I started to gather more information, it was evident that he was really concerned about how long he was going to remain in hospital and what he needed to do to get to a stage where he could actually go home. Yeah. And he didn't feel clear about that. Yeah. And I was able to kind of offer some empathy for that really, because being 12 years old, stuck in a hospital ward, away from family and friends, and not knowing what he needed to do to get to that, or not feeling that he knew what he needed to do to get to that, obviously must have been really difficult for him. And then I started to talk to him about who he had to talk to about these difficulties, and I think his mum had been somebody who had been on the ward quite a lot, but he actually came up with his dad as the person who was somebody he would normally talk to. And when I asked him whether there was someone else, his brother as well was somebody else that he talked to.
So you wouldn't have guessed that?
No, because his mum was the person who was most present, I guess. Dad worked a lot, but yeah, he came up with his dad, and I'd not met his brother. And when talking about how those people helped, I think they often, when he got distressed and worked up about things, I think Dad was a very calming influence who'd just spend the time to sort of help him to break down his problems and work through them really, and just spent a lot of time.
Quite insightful for a 12-year-old.
I think he was very. I think he was somebody who was a carer for a sibling who was having some difficulties as well. So he was quite a mature 12-year-old really. But yeah, he was definitely struggling. When I asked him what I thought he thought would be helpful at that time, he was saying that he thought it'd be really helpful to let Dad know exactly how he was feeling, and it seemed like he'd not really done that at that stage, to let his dad know how much he was struggling with this.
About the discussion you were having helped him come to that realisation?
I think so, yeah, but also I think at the time when we were having that discussion, being able to reconnect him with his support network, I think was really important, because at the time on the ward that morning, I think he felt very alone actually. His mum hadn't come on the ward at that stage. and he'd not seen his dad the previous night, and I just think that he was even more aware that he was feeling very alone at that stage. So being able to have that conversation about who do you have to talk to sort of like reminded him of what opportunities were there, really. When it came to what I could do, it was about him not knowing really, and him kind of feeling like he was in a bit of limbo as to what do I need to do to get home. And it transpired that what would be helpful for me to do was to go and speak to the physio around what he did need to do. And I agreed with this young lad at this time that maybe I would ask the physio to come and meet with us both, and for us to kind of set some kind of, so there was a bit of negotiation there with him about what would be helpful. And I think what we did was agree that we'd try and engage the physio and set up some kind of plan as to what exactly he needed to do, and for that to be written down so he could remember it, and he would know how far he was along that journey, really. And as we ended, it was like we had a plan, and he did genuinely seem more happy and relaxed knowing that there was a plan